Hey, how you doing? Good, thank you. All right, let me thank you. I apologize for keeping you all holding. You know, I think it's important to have these daily updates because there's so much floating around on social media, and it's important just to provide information to people so that they will have it. So let me run through a few of these things, and I'll be followed by Dr. Peirce, and then be followed by Chief Bunick over the Office of Emergency Management, and then Chief Pena and Chief Fenner. Steve Williams, of course, is with the Public Health Department for any of these individuals. I certainly want to thank Councilmember Kubosh for being here as well. Let me just kind of give you a status report. Houston has its fourth case now, and in the city of Houston, this is number 4. And again, this is a case that is related to an Egyptian cruise line. Okay, international travel on an Egyptian cruise line, and so for the city of Houston, that's number 4, which means that I think all of our cases have had some connection with travel, and I think it brings us up to the total number of cases in our region to 20. And so let me just stop and again remind people, international traveling right now is just not a good idea. In fact, just traveling, outside of the state right now, it's not a good idea. And so I've indicated to City of Houston employees, for example, all international traveling has been suspended until further notice, and all domestic travel must be approved by me before anyone leaves the state. So again, 4th case, but internationally connected, related to an Egyptian cruise liner, and the person is between 65 and 75 years of age, and is at home recuperating. Okay, did not require hospitalization, and she's at home, and Dr. Peirce can further elaborate on that. Let me just say, with respect to testing, a number of us met earlier this morning at the Texas Medical Center. We do anticipate expanded testing to start next week in the city of Houston, and so we're ramping up to for that. And so that should start sometime next week. Even as now, we've been able to double our capacity for testing with the Houston public the public labs, and Steve Williams can speak to that end. But we have doubled our capacity for testing internally, but we are anticipating expanding testing capabilities, working in collaboration with the Texas Medical Center on next week. As you know, the zoo is closing as of 7 p.m. Today, and will reopen on April the 3rd. And then with respect to our senior nutrition sites at Sunnyside, Northeast, and Hiram Clark Multi-Service Center, instead of the seniors having to come to those sites, we will be delivering meals directly to them at their home. So we're going to bring the meals to the seniors instead of having the seniors come to the multi-service center. That's at the seniors who normally go to Sunnyside, Northeast, and the Hiram Clark multi-service centers. We're also kind of streamlining some of our services, recreational services from Parks and Rec. We are continuing, though, any programs that involve children nutrition programs or where meals are provided. We're going to continue that through our Parks and Rec. We're not going to close those programs down. And then let me also speak to this, because it's been on social media quite a bit, that the city is shutting down. Let me be very clear, the city is open for business, and all employees are expected to be at their respective posts. I will be walking the halls, and out in the fields, but the city, because it was trending out there, the city is open for business. Now, we are reducing or rescheduling or canceling events that the city is producing or sponsoring or permitting, but beyond, and we are restricting certain initiatives or programs like recreational programs, things of that nature, But other than that, the city is open for business. Employees are expected to come to work, but we'll all be very responsible in terms of how we do things. And that is, we're not going to be engaging in shaking or hugging, and we're going to exercise some space as we do our work. But the city is open. It's open to business. There will not be any municipal jury selection, though, for next week. And so we're going to cancel jury selections for next week. And it pretty much coincides with regards to the fact that we're out on spring break anyway. There are no city council meetings next week, no public sessions, no city council meetings. But that was already scheduled. And so in addition to that, there will be no municipal jury selection on next week. With regards to faith-based organizations and things of that nature, I had a conference call with many of our faith-based leaders this morning, and one of the questions was, Mayor, what are you suggesting or recommending as it relates to church or going to worship service? And what we've said, we've not given out any directive as to you're not meeting, and so what I indicated to them, that is the decision that everyone must make, okay? For those churches, for example, like Lakewood, decide that they're going to have online services on Sunday, that's fine. If you want to go online, that's fine. For those faith-based institutions that want to meet in person, then I offer the following recommendations. Number one, no handshaking. Number two, no embracing, hugging, and three, social distancing or spacing. So don't be right up on one another, kind of spread out. The same things that I'm telling my city employees and telling others: no handshaking, no hugging, and social distancing and social and spacing. The reality is, for me, those who are very familiar with me, Sunday I will be at church myself. I will be there because it is one of those opportunities. Number one, pray for our city, pray for our country, and to be very thankful for the blessings that we have received. But we can do it responsibly. Okay? So if you want to go online, faith-based institution, understand that, please do so. If you're going to meet in person and worship in person, then there are certain guidelines: no handshaking, no hugging, and social spacing, social distancing. It's very, very, very important, and sanitizer and all of those good things. With respect to businesses, been hearing a lot even on social media. Mayor, you're saying close down. No, we're not giving any directives to private businesses to shut down. Restaurants, we're not telling you to shut down. What we are saying, again, be responsible, because it's still a city, we're still moving forward. A lot of events have either been rescheduled or have shut down. And so what we're telling people to be responsible. We're not saying to businesses close. I'm not telling you not to go to restaurants, not saying that. But we're simply saying, please be responsible. And then on the grocery stores, I just can't even, the mayor can't go to the grocery store and find stuff on the shelves. So let me say this. I know there's a lot of angst, anxiety, and people are fearful of this virus. But there's no need to go and bum rush the grocery stores. Let me say to you, the water is safe. The water is safe. If you even late on your water bill, we're not going to turn off your water through April the 30th. We're not going to turn it off. And the reason is real basic. We want you to be able to wash your hands. Regardless of your social economic status or your condition, your hardship, we're not going to turn off your water. And Houston's water is safe. So you don't have to go and buy several packages of bottled water. You can brush your teeth with the water coming from Houston. The water is safe. All of these other items, and again, I'm going to stick with my toilet paper. There's no reason to just go and buy it in large quantities, okay? And so let me encourage people, we are taking this coronavirus, COVID-19, very, very seriously. But I also want people to take a collective breath, because again, I don't want the fear of this virus to do more harm to us than the virus itself. Do we anticipate more cases? Yes. Are we taking every measure to slow the progression so we can flatten it out and it doesn't overwhelm our medical health delivery system? Yes. But there is no reason at all to rush the grocery stores. And having said that, let me stop, and now let me bring up Dr. Pearce.
Thank you, Mayor. So today, the Houston Health Department reported another case. This is an adult between the ages of 65 and 75 who was on a river cruise in Egypt. It should be noted that this is a different river cruise than the original cruise, which was several of our first cases. So this is a different cruise from Egypt. The patient is, the person is actually doing quite well and is at home. And of the 4 cases that we currently have in Houston, they are all doing quite well and they're all at home. And we're glad to see that. I want to point out that I know that people are paying a lot of close attention to the numbers, and so some of our current Houston cases are actually at the point now where we're testing them to wait and to see when they no longer are shedding virus and they no longer need to be isolated. So they're improving to the point that they will soon be dropping off our list. So you're going to see our numbers go up, and then you're going to see our numbers go down and fluctuate a little bit, and that may be confusing, but that's because as people are able to return to a regular lifestyle. So bear with us, that'll be a little bit confusing, but we're going to be talking about the cases that we have that are current active cases, and I think it's important that everyone know that in a city of 2.3 million people, we have 4 cases. And while we're doing a lot of measures to reduce the spread of the virus, as these numbers remain low, that is exactly what we intend to happen. So the mayor and the judge have been very aggressive and early, which is what we've advised them to do. If we're going to slow down this virus, you can't wait until you're behind the curve. You have to stay ahead of it. And so right now, if the numbers are low, that's a good thing. That's exactly what we want. I'll also point out that today, Galveston reported their first case. And so, again, that's not a surprise that we were going to see more cases. But the whole point is that if they come in small numbers every day, that's exactly what we want to have happen so that the healthcare system can handle that burden. The mayor mentioned that we've doubled the ability to test, and we will be hopefully increasing that even more as we start receiving some more equipment to be able to do more testing. And then finally, I just want to point out the issue of social distancing. And you'll notice that even here today, the folks behind the mayor, we've got a couple more inches between us than we have in the past. And I want to also point out that I've noticed that a lot of people have, as the mayor pointed out, stopped handshakes and stopped embracing. And while that's unfortunate on one hand, it's exactly what we need to have happen. And so I'm really proud of this community, and I'm proud to be a member of this community, because once again, when faced with adversity, we're seeing Houstonians to the person are stepping up and doing the right thing to protect themselves, their loved ones, their family members, their neighbors, and their coworkers. Thank you, Mayor.
Thank you. And we'll say that as we do more testing, we're going to expect more cases. Okay? We're going to be in this for a little while. And I do want to underscore this. This is not, 1 week and done. As we do more testing, we certainly will be expecting more cases. But at the same time, let's be very measured in our approach as we go forward. Chief Buny with the Office of Emergency Management.
Great. And thank you, Mayor, for your leadership and guidance, not only to us, the department directors, but also to the citizens out there for providing the factual information and the transparency to keep everybody informed on this matter. This afternoon, or actually this morning, the city's Emergency Operations Center increased its activation level to level 2. That's enhanced steady state. We've been working on this coronavirus issue for the last couple weeks, and it seems like each and every day we've been working a little bit harder, so we're monitoring and coordinating resources 24/7 until we get a good handle on this issue and the cases start getting down. As far as some of our task forces that we're working on, one is very important, our PPE task force, that's personal protective equipment. This afternoon we sent out a a STAR request, State of Texas Assistance Request, for additional PPE equipment since the governor and the president declared the disasters and emergencies. So we're hoping to get some additional equipment. Right now, we've already checked and surveyed with the medical profession through SETRAC and through the TMC hospitals and through our city departments. We do have enough of PPE equipment for first responders and hospitals, but if this issue goes on the long term, we're going to need some additional assistance from the state and federal government for them to open up the strategic national stockpile to get us some additional equipment to keep our health professions and caregivers safe. A couple other things we're working on in the city. We're making sure that all the city facilities are cleaned and sanitized. Our Metro bus, we've been talking with Metro. They're doing enhanced cleaning services. And then lastly, the mayor mentioned the food supply and the issues at the grocery store. For the past week, we've been meeting. We have a supply chain management group that involves all the local grocers and distribution centers. I was on the phone this morning personally with HEB. They've reassured us that they have ample supplies. Just like the mayor said, they're not running out. Their shelves are running a little bit low, but that's a replenishing issue. They're working 24/7 to keep the stock rolling. They have plenty of resources to make sure that everybody gets fed and has plenty of water in the near future.
Thank you. I will add that as we do this expanded testing, though we have some PPEs, personal protection equipment, in-house that we've accumulated over the years. On Saturday of last week, as I indicated before, we sent 10,000 N95 masks over to the medical center. And based on the conversation we had this morning, as we go to this expanded testing, literally you could utilize thousands of PPEs in any single week. And we're not going to be able to just wait on federal supplies to come. We hope that they will come. And so I've indicated to Tantra Emo, the finance director, and as I indicated to Councilman Kubash not too long ago, that we will have to probably tap our economic stabilization fund to procure PPEs for our testing. So that's going to place a financial strain on the city. But the testing is important in keeping people safe. And as you know, right around the corner, of course, is hurricane season. So you just have to do what you need to do with the situation before us. Chief Pena, the fire department.
Thank you, Mayor. So I'm going to give you a quick briefing as far as the fire department's operations and what we've done to prepare for response to the coronavirus. The fire department and the 911 communication center has already made some changes to the call query protocols. So we're asking certain questions. Again, it's to gain situational awareness for our firefighters. And as we gain that information, we pass it on to our first responders, our EMS personnel, our firefighters, in order to prepare them to have a heightened sense of awareness on certain flu-like symptom calls and the sick call types. We've also made some adjustments to our equipment caches and what we've deployed out into the field. I can tell you that we have a healthy supply of personal protective equipment. We have over 47,000 N95 masks on hand. We have nearly 3,000 gowns on hand in our warehouse. That's on top of whatever we've deployed to the fire stations already. And we've provided the training and the resources to our firefighters to be able to safely approach these incidents. We've had a number of low-level exposures to our firefighters. Those are self-monitoring, which means they're not losing time at work. We have one that was a medium risk monitoring. That one has resolved. The patient came back with negative, so that individual will be returning back to full duty. And again, it's about being able to provide the information to our firefighters. Proper wearing of their personal protective equipment and approaching these scenes safely is what's going to mitigate exposures to our firefighters and not create a burden for staffing and quarantine. The actions that the mayor has taken in declaring an emergency, a disaster for the city, as well as the governor and now the president, are going to go a long way in ensuring that we are able to access personal protective equipment as it becomes available. One of the issues that everybody is having across the nation is the fact that the supply chain of this equipment, one, it's high demand, and two, the supply chain is not as robust as it should be. So, but thankfully, we've been able to plan ahead. We've been able to purchase some things ahead of time, and which allowed us to do have a healthy supply of that equipment. And you know, again, I think what we've been able to demonstrate here with what the mayor said, what the other city departments have done, is that the systems are falling in place. Okay, and this is a manageable situation. And what I would recommend is that people just use common sense. You know, don't touch your face or your nose or your mouth without washing your hands first. Use common sense, spacing, distancing. That's going to go a long way in limiting the number of exposures, and it's going to go a long way in allowing us to properly serve this city. I want to reiterate, we are not closing down. The fire department is at full strength at this moment. We're staffing every available apparatus that we have in the system, and we're going to continue to do so in the foreseeable future. We see nothing changing as far as our deployment status, how we're deploying, and the equipment that we have available for our firefighters. So, okay.
Thank you.
Thank you.
Chief Fenner.
Good evening, everybody. Thank you for your leadership, Mayor. I don't want to repeat everything that the Chief Pena said. In our response is very similar. We've taken the extra steps, and we're at full force. What I do want to say is, in the city of Houston, we have the best leadership, best city council, best police department, best fire department, best citizens. Everybody just simply got to ratchet down. Let's come together, and I want to hit on the stores again because it's important from a public safety standpoint. What good does it do for anyone if 1,000 of our citizens go in and grab everything out the store, and we still got 2.3 million that we have to get stuff to? So let's be who we are, good, loving Houstonians. Let's take care of our neighbors, and let's just ratchet down a little bit. We've put things in place that's going to get us through this just like anything else. So the police department is here in partnership with our great fire department with great leadership, and we're going to move the city forward. Thank y'all.
Let me bring up Steve Williams, who's over our city's health department, who's been kind of monitoring this situation from the very beginning. Director Williams.
Thank you, Mayor. I only have one comment to add on as it relates to the health department's response and responsibilities, in addition to what the mayor and Dr. Persis said. Today, the mayor, thank you, approved an additional to our laboratory staff to ensure that we're able to continue to meet the testing demands that are presented to our laboratory. We're also going to increase our epidemiology capacity, which is responsible for following up on case contacts. Those are the people that are responsible for reporting out the amount of tests that we've done and also the positive results that we've gotten. We also have we've ordered additional testing equipment, anticipating that there will be an increase in demand.
Thanks. So, is this a serious situation? Yes. Okay. Is it going to be with us for a little while? Yes. Are the numbers of confirmed cases probably going to increase in the city of Houston from 4 to a higher number? Yes. Are we taking steps to slow the progression? And without question, yes. And not just the city of Houston, but organizations at all levels. Okay? And we are taking such dramatic steps to reduce people's contact, encouraging people to practice proper hygiene, to engage in distance spacing, along the way. So all of those steps are being taken. It's a very serious matter. We're taking it very seriously. But having said that, for the people in the city of Houston, this is not our first time at a situation of this kind. and we will get through it. But the lesson learned from previous disasters is that we get through it when we work as a unit, when we work together, and when we don't panic. And so that's why, you know, and lastly, I'm encouraging people to get your information from credible sources. And unfortunately, social media is not it. Okay? So get your information from credible sources and not buy into the rumors. City is open, and we're going to proceed. And now every day, every week may be different. And depending on what we see next week, the actions that we take could be different than the actions, or could be in addition to what we have taken this week. But we'll take it day by day. Now, let me stop. Any questions to any of us?
You know, we've been telling people if they have symptoms, call your doctor. You know, don't go to the hospital. The weekend is here. A lot of doctors, you know, are not in their offices. What advice would you give to people over the weekend if they think they have symptoms or they become concerned?
They certainly could call the city's number, which is 832-393-4220. They can do that. Dr. Purse? Steve? Dr. Purse, you want to add to that?
Yeah, so you're right. The weekends are a bit of a challenge. The clinics that are usually open Monday through Friday are often closed on the weekend. And so the other thing to keep in mind is that most people are going to have a mild illness. About 80% of folks have a mild illness. So if on Saturday morning somebody wakes up and they think that they may have it, and they call their doctor and they get the answering machine and they can't, if they're not critically ill, if they're not seriously ill, just isolate yourself at home so you don't expose your family members. Wait till Monday. Again, you know, assuming that you remain pretty healthy the whole time. But anytime somebody gets seriously ill, that would be the time to call ahead to the emergency department and go. That's the only time somebody should go to the emergency department with this, is if they're really seriously ill. But in the meantime, because most people are having mild illness, and because there's no specific treatment, right? So they've got a couple days, as long as they remain well, and just wait until Monday, call your doctor, and get into the system then. That should be just fine.
We've met with the medical center and most of the CEOs this morning. We are putting in place, we're working through the logistics now, and we are anticipating sometime next week. But we are all looking at the logistics, working with the fire department, working with the police department, working with the county, because we're looking at a regional testing sites, multiple, okay? So, but rollout, I anticipate sometime this coming week.
What exactly does expanded testing refer to? I mean, how much capacity increase is for anyone? And by next week, should we expect Monday, or do we not know when that capacity will go up?
Yeah, I wouldn't say Monday, and what I mean when I say expanded, right now, what the Texas Medical Center, the hospitals are saying to us, is that they have enough capacity to take care of the people that are coming to their respective hospitals, okay? So for the people who are coming to their respective hospitals right now, they have enough capacity to handle that load. Now what we're talking about is going beyond the hospital walls themselves and testing out in the community, still probably with a doctor's notice or something like that, but expanding beyond just individuals who may just be coming to their hospitals. Dr. Percy.
The mayor is exactly right. So right now, and I think it's important that everybody hear what the mayor said, is that the hospitals are able to meet the demand of the folks who are coming in and who need to be tested, who medically need to be tested. And yes, they're having folks who are coming in who are, you know, simply scared, and they have no contact with anyone. They don't have any of the symptoms, and those folks are generally not being tested. But people who have the right story, the right physical exam, the right findings when they evaluate the patients, they are being tested, and the hospitals are able to keep up with that testing. Our public health lab is able to keep up with the demand that we're getting from those places that don't have their own testing ability. And so, you know, it was only a week or two ago when the hospitals weren't yet testing, but they are now. And so, as a community, we have more depth, which is going to take a little bit of the load off of our public health lab so we can serve those who don't have any other way to get tested. When I say those, I mean those hospitals and those medical facilities. And as the mayor pointed out, we're working on expanding that. Again, the concept is to stay ahead of the event. So right now, in the city of Houston, we've got 4 cases out of 2.3 million people. We've done several dozen tests of people who met the indications for it, but we know what's coming. And so the goal is to be ahead of this so that when people, if the virus, and we have to assume unfortunately that it will, but that's our job, but if the virus should spread and we start getting an increased number of people, we will then have the testing capacity to meet that demand. So right now we remain ahead of the demand, which is where we want to be.
What would you recommend for those who don't have health insurance, who are nervous about even showing up to a hospital or ER or a doctor's facility because of those high costs?
We've been very sensitive to people who may not have a primary physician, and so we want to encourage those persons to call the city's number, and that's 832-393-4220. We've also been very sensitive to our homeless population. And I've also approved additional funding for the personal protective equipment for people who will be going out to our homeless population. We don't want to leave anyone out. I will tell you, I was on a conference call today with 84 other mayors, including the mayor of Seattle, who is like the epicenter, in which she was providing advice to all the rest of us, and that is to, they had their first case, but then it was like 2 weeks later that things just started really escalating. And one of her lessons was to get on it early, okay, to take the necessary steps early, to avoid these large events and all this, to do it, don't wait for the cases to show up, because if there's one, you can assume that there are others out there. So don't wait until your numbers get up into the 30s, 40s. Assume if there's one, then take the necessary steps to start, avoiding these events, and get ahead of it to try to contain and then mitigate. And that will help in the long run. And that's what we're attempting to do.
Mayor, the drive-through testing is working in other places. Is it challenging from the management that you're trying to ensure that you're not going to have mass people show up and say, I'm here, I'm driving, how do I get tested? The setup of that, you kind of going to see some challenging things with this setup?
The challenges with it, number one, is that when you're doing I want to say expanded testing beyond the walls of the hospital, for example, number one, you have to have the PPEs, the personal protection equipment, especially for the healthcare providers. Because if they're not doing with the proper equipment and then they contract the virus, then you've got the healthcare providers who will impact it, and that impacts everyone else. So the PPEs and what the doctors have said to us, that's a critical component. That's a must. You have to have those to get started. And then the second thing, for example, would be like the trailers, where you're setting up. And we are working, and we'll working with the county, and we'll provide those. And then you have to have the security out there. So that's important with your first responders. And then the question is, who is being tested? And if you're not showing any symptoms, then there's no reason for you to be tested. And so like in Denver, for example, in Colorado, you have to have a doctor's order, some sort of order. Not everyone can just come and show up. And so the question is, okay, so what are the requirements for people to come? And so we're working through those particular logistics.
We could talk to the vulnerable communities, especially the homeless. They're supposed to immigrants, undocumented. The public are scared, terrified of this situation, and they don't have help. What is the message for them?
Well, the message, and I'm glad you asked, and that is that we don't want to exclude them at all. We want to be very sensitive to them. I would tell you in the meeting this morning with the healthcare providers, Judge Lena Hidalgo was there this morning, and that was one of her major points to our immigrant community, individuals who may not be documented, because this is the time it doesn't matter what your status is. We don't want anyone to contract the virus, and we want to make sure that everyone is attended to. So as we set up these protocols, or set up these testing sites, we want to make sure that they are accessible to everyone, and we want to let people know that no one is excluded from making sure that we are responding to your needs and your health and your safety and your welfare. Everyone is included. And if you will, on that point, because it's so important, Chief Pena, if you will speak to that.
Sure, sure. You want me to speak to that in Spanish?
Yeah.
Bueno, lo que queremos decir y lo que dijo el alcalde Turner es que a la comunidad migratoria no importa su situación migratoria. Si tienen caso de llamar a asistencia, que no tengan temor o no tengan miedo de llamar para asistencia. Para eso estamos aquí, está el Departamento de Bomberos, el Departamento de Policía y otros departamentos de la ciudad para asistirlos en estos casos. Es muy importante comunicar que esta situación del coronavirus no importa el estatus migratorio, ¿sí? Si ustedes necesitan ayuda, acudan a su doctor o acudan a los servicios que están disponibles en la ciudad. Queremos comunicar eso a nuestra comunidad migratoria porque es muy importante que todos estamos aquí juntos para poder combatir este virus juntos y queremos que no tengan temor, que no tengan miedo de llamar para cualquier asistencia que se necesite.
The One Health approach works. When are we going to start hearing the voices of the vets in this discussion?
Say it one more time, I missed it.
Maybe Dr. Pierce will be able to provide an answer. I said the One Health approach works, which is the relationship between the environment, agriculture, and animals. So when is the vets going to be involved in this discussion? Because we've not really been
The vets. When are the vets?
the voice of the vets,
animals?
the veterinarians.
So I believe that around the globe, we've only got one documented case of a domestic animal being infected with this. So I'm not a veterinarian, but at this point, that's a low risk as far as I know, and we have bigger risks working with about humans. Now, that may become an issue, but in China, which has thousands and thousands of cases and Wuhan is a very modern city, we're not hearing that domestic animals have been a problem. Like I said, there's one case that I've heard of, maybe somebody's heard of more, but there's only the one case that I've heard about, and it has not been an issue that has been broadcast for us to worry about. So I think, for the most part, it's going to be okay. The veterinarians are watching the news, and the veterinarians that I've talked to have told me, because I've reached out to them to ask, they've told me it's not something to worry about, but I do know they are paying attention and keeping an eye on things. But what they've told me directly is that they don't anticipate domestic pets being an issue with this virus.
Because the origin of the virus, since we say it's new, it's related to certain animals in China.
Right.
So
Well,
we're
they-
going to have a baseline
Right.
and some research parameters and other resources
Yeah, so the
behind then that discussion.
so for this particular virus, to that point, it's about 80% bat, and there's a particular species of bat, and I can't remember which one it is, but it's a particular species of bat that is found in China, and also an anteater, which again is a particular species of anteater that is found in China. And the viruses of those two animals mixed to create this virus. So here in the United States, where we have neither of those species, I don't expect that we're going to have a problem, whether in domestic or in wild animals.
Let me just say that I anticipate that these briefings will continue through the weekend, because I don't anticipate the coronavirus stopping. So we'll continue to have these briefings because what is important is for people to get the information, because that's what's driving people's anxieties or their fears when they're getting misinformation or rumors. I will tell you, this is new territory for everybody. I mean, this is new territory. We have not experienced anything like this. And all of the mayors that were on the conference call were in agreement. This is just new territory. So I wish I could tell people by the end of next week we'll be through it, or by the end of March we will be through it. Or the fact that the weather is getting much warmer, and this is a seasonal deal. But we just literally do not know. But what I do know, in order for us to get through it, all of us will have to pace ourselves. And that's why we will work against each other if we rush to the grocery stores as if the storm is going to land tomorrow and we're stocking up for the next 3 to 4 days. This is not that type of matter. It doesn't work this way. In order for us to get through it, we're going to literally have to pace ourselves and work with one another and change our habits. And in a city that's so friendly, we're just going to have to stop shaking hands and, embracing, and we're going to have to engage in some social distancing or spacing, and that's what I said to the faith-based leaders. For now and in the foreseeable future, we're going to have to learn even how to worship in a different way. Not so close, kind of separate yourselves a little bit, in some cases online, but we will get through it. And that's why we're not telling businesses to shut down or restaurants to shut down. We're just going to have to find a way to carry on our day-to-day business, but do it in a responsible fashion. The city of Houston, for the 21,000 employees in the city of Houston, on Monday, I will see you at your post.
Mayor, real fast, do you know the impact of the President's emergency declaration on the city of Houston specifically at this point?
I would tell you that the President's declaration was very, very, it was very important because we're having to expend dollars ahead of time, and quite frankly, for the Economic Stabilization Fund, the money was just going to be put back in full in June of this year. So we're having to look at pulling from that fund right now with the hurricane season coming right behind this. So, and hopefully that the emergency declaration will free up more resources and will help us to maybe move forward even quicker with procurement, things of that nature, because I anticipate we're going to be in this situation for the next several weeks, if not the next several months. So we'll be in this situation for a while. Thank you all so very much, and we'll be